So as we talk about comorbidities and how sleep apnea is affecting our overall health, it's important that we understand what things it's actually related to. So we've got a couple of slides here from the CDC studies that have been done on a macro scale, meaning we're looking at the entire United States and the prevalence of certain diseases and the prevalence of insufficient sleep. In a macro study this large, what we're looking for is trends. As you can see from the picture on the left, the darker the color green, the higher percentage of people with insufficient sleep. Now that's a self-reported statistic of people that have had insufficient sleep or are tired more than half of the month. On the image on the right, you can see that the darker color represents increased heart disease death rates. And you can see that the darker green also correlates with the darker red. So the pattern in the United States and the prevalence of insufficient sleep and heart disease death rates directly coincide. Now you may be thinking, well, what if that's just diet? That's fine. If we looked at the amount of calories consumed and what type of calories, we would probably see a very similar incidence rate. But when you look at insufficient sleep and you look at these diseases, you're going to see a direct correlation. So now let's look at stroke. You can also see the direct correlation in the higher purple colors. The darker the purple, the higher the percentage. Again, correlating the same with insufficient sleep. And on this last one, you can see in the darker color orange, that's the higher prevalence of type 2 diabetes. Again, mirroring the higher prevalence and incidence of insufficient sleep. So when we look at these factors, we can clearly understand that yes, how we sleep matters. And it doesn't just matter to how we feel during the day, i.e. our energy level or fatigue, it directly impacts our overall health. And if we merge those two conversations together, we can really help patients understand a bit more of how this is impacting their actual health and other things that they may be struggling with and have just thought that it's part of their family history.